Now, let me tell you the clinical features of this condition. So, first, it starts with toe walking because the muscles that pull up the foot are very weak, and later it results in something called a foot drop here. And the more this happens, there's something called a contracture in the heel here. So, a contracture refers to shortening of the muscles, which is usually permanent. Okay. And so due to this, the children initially they are not able to run as fast as other children. They start tripping on their feet. There's sudden episodes of falling. All of that can happen. Okay. And some of the other features are the buttocks. The buttocks, that is the hip. Buttocks are actually hip straighteners. The muscles in the buttocks actually straighten the hip, which enables people to stand and walk. So next, this becomes weak. The children find it unable to get up from a seated position. Usually, they can do it with support, but gradually, even with support, they won't be able to do so. I will show you a characteristics sign seen in DMD in the next slide. And the knees usually might bend back so that the body is more supported. And as you can see here, there is something called an anti-gravity, the anti-gravity muscles. So these are the muscles that have to act against gravity, like pulling this up and getting this up, all of that. So these will start getting weak initially, but eventually everything starts to get atrophied or starts shrinking. So once it affects the leg, it starts affecting the hands. So usually the shoulders and arms are held like this. So all the doctors, you can notice that there is a retraction here. So usually there's a muscle here called serratus anterior that brings the shoulders forward. So that becomes weak. And later, even these muscles here, the shoulder muscles may become weak and making it difficult for them to lift their hand without support. And later, it starts involving the elbow and also the wrist. And if eventually over time, all of this do go into a contracture, and the best way to prevent that is by doing regular physiotherapy, which I'm sure will be told by the other doctors. And see, this condition is very greedy. It doesn't talk with just this and this. Later, it starts affecting the spine. So here, this is what we call the lordotic spine, where the spine comes excessively in front. This is due to the muscles here and also the belly being weak. So as you guys know, these abs are very important for support, but because these are too weak, it enables it to come forwards, and later the neck starts getting weak. And I don't think that's all. There's still a lot of things that can happen with this condition. It's very greedy. See, come on, let's see what else it can do. Okay, so this is a Goer sign, which is characteristic sign for people with muscular dystrophy. And if there's any doctor out there who notices this in a child, please help them contact the neurologist so that it can be diagnosed early. Yeah. Okay. So this is a Goer sign. So here is where the child is sleeping, and look at how he's getting up. He takes the support of the floor, and see, only with the support of the floor and later with support of the thighs, a child can get up. So this is Goer sign and is very specific for Duchenne's muscular dystrophy. Okay, now let's go to the dangerous things that can be caused. In DMD, usually the nothing happens to the lungs, but it's almost always due to the muscles involved in it that cause problems. So whenever there's a problem with these muscles, that is the intercostal muscles and the diaphragm, we get something called a restricted lung disease. So it is because these two muscles that I mentioned, they don't allow the chest to expand completely. Okay, and see, as I mentioned here, intercostal muscles, these are the muscles between the ribs, and the main muscle is the diaphragm. So that's why I would request all people with this to do regular breathing exercise to prevent all of this from happening. And in addition to this, sometimes it can cause an airway obstruction here, which causes difficulty in breathing, and the spinal cord being involved. Like as I mentioned, the lordosis and sometimes scoliosis, that is sideways tilting of the spine, can cause problems in the lungs. So everything is basically because the it causes some problems in expansion of the things, and sometimes there can be something in the brain that can trigger this. So another important thing to be aware of is something called cardiomyopathy. So cardiomyopathy in simple words means it's a condition which causes problems with the heart muscles. Okay. Uh, so this is a normal heart. So these are the chambers of the heart. Okay. And in early DCM, you can see that there's something here, and there is not much change here. But in the end stage dilated cardiomyopathy, look at how big it becomes. So because of this, the heart is not able to pump blood effectively out of it. So this we can chuck in an echo with something called ejection fraction, that is how much the heart is able to pump out blood. And also we look at, after heart pumping out blood, how much blood is still left in the heart. So that indicates the function of the heart. Okay, and the usual investigations done are creatinine phosphokinase. So this is a marker which indicates breakdown of the muscles. So this will be very high. So an EMG or an electromyogram is where you put electrodes and stimulate the muscles, and you look at, once you stimulate, how they contract. So in DMD, obviously there will be some problems, and biopsy is the best way to confirm whether it's a DMD or not. So biopsy, I'm sure everybody knows, usually the biopsy is taken of the bicep muscle, so that you can find what is wrong. Okay. In addition, there are some genetic tests. Like before we had PCR, and now we have things like MLPA, etc., which will tell exactly which gene is missing, which exon is missing, and hopefully it will result in targeted treatments for that in the future. Before finishing, I would like to talk a few words about the mental health aspect of DMD. So, the first and foremost important things in these conditions are, the one is the social support, and one more is the environmental support. So, social support refers to people understanding that people with DMD are also humans, and actually treating them like humans instead of doing the other way around, like uh, you know laughing at them, joking at them, ignoring them, being very insensitive to them. So these kind of things, it really puts people with DMD down. But otherwise, if you are like you provide a good social support to people with DMD, it's very important. So first of all, I urge all the parents of children with DMD to encourage them to do whatever they like and be a very important source of support for them. And the other part is the environmental support. See, many buildings, especially in certain cities, they are not accessible to people with uh, DMD and other conditions. So I would like to send this message through to people, to the higher ups who are involved in this, to please create some a supportive environment so that people with DMD can go where they like, they can socialize. See, because people with DMD are also human beings like everybody else. And one of the most common challenges I've found in people with DMD is that they say that nobody can understand them. They don't have any friends at all. Yeah, and I mean, unfortunately, in sometimes you do end up in certain situations. So I would also like to tell you more about how you can handle this sense of loneliness when you don't feel you have anybody around with you. Yeah. So obviously, I would like to talk about the mental health aspects in detail some other time. And I would like to leave you with this figure, which will show you the difference between a normal muscle. See, here a normal muscle, and the one which is dark is the muscle membrane. Okay, and here you can see that they're not as good as normal. Still, it the stability is not here. Compared to this, look at here, it's almost like non-existent. You can hardly make out faint outlines of muscles. And towards the end, I would like to thank a Bharat MD Foundation for giving me an opportunity to present about DMD on World Duchenne Awareness Day. And I really hope my talk today has been helpful. Thank you.